welcome to Inspired Stretch with Dr. Gold.
And Dr. Gold.
We are going to be doing a stretch for allergies.
Good. I have allergies.
And there's a lot of things you can start to do to feel better, to open up your sinuses, to breathe better. So if you're suffering with allergies, no more. So we're going to talk about natural treatments for allergies today. We have Dr. Gold. Yes, I head to school
I got to
today.
get to work, so I just wanted to say hi. Good morning, everybody.
All right, let's get started now. We're going to just start with a nice warm up. So inhale those arms, reach, reach, reach. And reach all the way over. So for those sinuses, we're going to do a gentle massage to begin with. So I just want you to use kind of the inside of those fingers, and we're just going to kind of open up the sinuses. And you might feel a little sore here. So remember, there's several sinuses in the face. This is a prominent one. It's called the maxillary sinuses. Maxillary meaning more in the cheek area. Breathe. Oh, it feels so good. And you can just kind of press on that area. Just breathe into it. Good. And one of my favorite go-to stretches for the sinuses is the Nadi Sudi type of breathing. So it's called alternate nostril breathing, but it can help clear out those sinuses. Feel free, if you do have essential oils, eucalyptus, menthol, those also help. So you can actually have a diffuser. If you don't have all this, don't worry, but just for the future, a diffuser, and then you can actually be breathing that in as you do this exercise. So just think of the thumb and the pinky finger. We're going to close off your right nostril with the thumb. You're going to exhale through the left nostril. If you can, if you're all congested, just do the best you can with that. So you exhale through the left nostril, inhale through the left nostril, and I actually misspoke. It's the fourth finger. We're going to just, fourth finger. You're going to close off that left nostril, open up the right. So you're basically just alternating nostrils to breathe. So exhale, inhale, close it off, exhale through the right nostril, and then inhale through the right nostril. Now it looks weird, but it's so good for helping to open and breathe a lot better. So let's try it just, again, doing at your own pace. So exhaling through that left nostril. I'm actually whistling. Inhaling through the left nostril. Close it off. Exhale through the right nostril. And inhale through the right nostril. Good. The great part, if you can continue to do this for just a few minutes, again, those sinuses can start to open up. So I'm going to take a little break. We'll get back to it in a moment. Interlace those fingers. Big smile here. Good. Rotate those arms up, 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 up. Reach, 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 reach. Good. And then just rotate around. Rotate around. So really important to stretch out your body. Feel really good. Good. Reach all the way over. And then over to the other side. Good. We're going to shake the body today. Don't forget to shake, 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 shake. Rotate those shoulders. Good. And reach the ear to the shoulder. So oftentimes when we are congested, suffering with allergies, our whole area just feels like, oh, there's all that pollen. Just remember those histamine effects. So those cells release histamine that can lead to a lot of fluid moving into the area and just feels clogged up. So a nice way to kind of release, especially when you're sleeping, is sleeping a little more upright. Because we know if we lay flat, all that drainage goes to the back of our throat and it can keep us awake, get us to start coughing. And one of my go-to is Olbas. If you haven't heard of it, I would check it out. You can find it on Amazon, Olbas. They also have it at the health food stores, Olbas. It's a great cough drop, helps soothe the throat, helps open up those airways. It has eucalyptus and menthol, really wonderful for sinuses. Good, so we're gonna open, 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 reach, reach, reach. Okay, let's go back to that breathing technique again. Remember, if you're just joining in, welcome to Inspired Stretch with Dr. Gold. I just want to show you my whole garb today. I have a little tutu back. Remember, you can dress up any day to celebrate life, to have some fun. So I'm using my thumb and my fourth finger. My thumb is going to close off the right nostril. I'm going to exhale through the left nostril. We're going to do this 3 times. Exhale. So probably about for maybe 3 or 4 seconds, exhaling. Inhale for 3 or 4 seconds through the left nostril. Close it off. And again, if you're stuffy and it's, whistling your nose, that's okay. Just keep going with it. Exhale through the right nostril and inhale through the right nostril. Close it off with the thumb and then reverse. Go back to the left, exhaling through the left, inhaling through the left. Hold it, close it off with the fourth finger, exhaling through the right, inhaling through the right. Let's do this one more time. This is called Nadi Sudhi or alternate nostril breathing. Exhale through the left nostril, inhale through the left nostril. Close it off with the fourth finger, exhale through the right nostril, and inhale through the right nostril. Good. And breathe. Just notice how that's feeling. I'm going to massage those sinuses again. So just gently with those fingers, press, press, press. So another sinus is the ethamoid sinus, right kind of in the forehead area, sometimes right up with the nose. So just kind of pressing. Actually, this is a frontal sinus, forehead, and then the ethamoids are right above the nose. Just kind of pressing into those areas. Oh, it feels good. Sometimes our jaws can click too, just if you're tight. So we're going to massage out those jaws. Oh, I have TMJ, so this is really good for releasing. Good. Okay, so let's massage out the forehead. Big smile. Good. Massage out the back of the neck. So another thing with sinuses or allergies, there are some natural antihistamines. If you're interested, I like orthomolecular. I get the D-Hist. If you haven't heard of that, that's really nice. Back those hands together. So cross one palm over the other, so palms touch, and then rotate. Good. And the other way. Good. Keep breathing here. Good. And then just rotate off to the side and the other side. Good. And the other nice allergy medicine that I like is Quercetin. That's kind of a long word. It sounds a little funky, but Quercetin spelled Quercetin, Quercetin. And it's actually a nice, I use it as a nice supplement for allergies. It works really well. Good for that body. Has helped when I was really congested to loosen up things, to help keep stretching. There we go. Yeah, honestly, I got to look up the mechanism again. I forgot. I think it's a good antioxidant, but I'll check it out. Don't know everything, but I know it does work for allergies. Keep breathing here. Rotate. Open up those arms. Give yourself a big hug. But the D-Hist is a natural antihistamine. And remember, when we have allergies, whatever is released, so if you're congested, you're not feeling good, when you take an antihistamine, it'll help for future events. Whatever has been there, that's where the quercetin comes in. It's kind of helps with the antioxidant, cleans stuff up. And when you're using eucalyptus menthol, that's the symptomatic relief. For the antihistamine effect, that's for any future effects, generally speaking. It helps with allergies that you might be exposed to later. So if you're allergic to oak and you know you're going to go outside, take the D-Hist ahead of time. That can help. That's the same if you have conventional medicines like Zyrtec or Claritin. I have some folks, sometimes it does work right away, but I have a lot of folks say it takes a little bit of time, and that is true. So be patient with yourself, and then if you can limit exposures, if it's high pollen and you're allergic to pollen, reducing outside exposure. Oh, and then also see yourself getting better. That mindset is so important. I have many patients say, Dr. Gold, I suffer with allergies. It's so bad. I'm like, I hear you. Make sure you're hydrating, drinking water. But if you keep focusing on, the discomfort or the pain, how are you going to feel? Yeah. So we want to start focusing on getting better. You can even create a little vision board of feeling allergy free or just allergy reduction, just symptoms improved, smiling, a nice picture of you, seeing your sinuses open and breathing better. So we have little bones in the nose. They're called turbinates, and they can get boggy or swollen. Typical signs of allergies, you'll see they call it the Colonel salute. It's just like a purplish line over the nose. It's because we tend to rub the nose so often, or sometimes bluish hues underneath the eyes. So if you have bluish colors, it almost looks like raccoon eyes. That again can be from the histamine release. It can cause discoloration in the eyes. It almost can get baggy and swollen. The whole body sometimes, or the whole face can feel swollen as well. Headaches, again, that congestion, runny nose, coughing, not fun, I know. But I love the OBAS. There's Buckley's, not a fan of the taste, but it really works to clean you out and get those sinuses clear. I've used horseradish before, but hot steam is a go-to. It's an oldie, but one of my favorites too. I'll stick some peppermint tea in there and just put a towel over, a towel over my head and just breathe into it, and it feels so good for that. So, okay, let's roll. Now let's put ears. I'll bring it back. Shake out the body. So important for you to take a listen, whatever's going on. If you're not suffering with allergies, but know somebody who is, if you want to share this video with them, I appreciate it. And just, feel free to chime in with questions, because the goal is that you improve and you are feeling better. So let's shake out the body. We're going to work some of the back too, because honestly, allergies can affect the whole body. We can just stiffen. Maybe we're not going outside as much. We're not exercising as much, so our body gets tight. So moving around, creating a good flow helps also with good blood flow as well. And it's actually good to exercise. It helps get stuff moving and going rather than just being still, or just, again, as I mentioned, not to lie flat, because all that drainage goes to the back of the throat, can make you cough. Better to sleep a little upright when you're sleeping. Okay, so if you have a little bench or chair, if not, just extend your leg out, and we're going to lengthen. What I want you to do, notice my knee is bent. Spread your toes. Feel the pinky toe reaching towards you. It's going to stretch the front of the shin, or excuse me, the front of the lower leg, so your shin area. So feel that stretch there. And we're going to feel the right hip moving back. So this is a good hamstring stretch. We're going to bend that knee again. Knee over the ankle again. Big smile here and open up those arms. Good. Breathe here. If you need to do this in a chair, you can sit down and just bring the knee to the chest. Good. Gently rotate, 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 and rotate again, just like a helicopter. Just rotate those arms. Helicopter arms. Whee! There we go. You get dizzy, just take your time and hold the pose. Good. And we're going to switch sides. So bring the other leg up. Spread your toes, pinky toe up, up, up. Good. And then rotate those arms again. Good. Take a nice deep breath in. Lengthen the spine. Feel the top of the head reaching up. Good. Bend that knee. Good. So I did want to put this out there too. If you're interested, you can type in the post as well, where I want to start going on Zoom so I could see folks that want to be seen. Again, you could always close your video. But I think it's so important, because that way I can get feedback directly from you. And if you have questions, you can ask them. And, sometimes people want to know something right then and there. So just if you want to let me know if that's good, we can put that out there. But I'm thinking I'm going to go more Zoomy. I know people are zoomed out. I am too. But it's just a nice conduit, because with the live right now, I can't see anybody. I can hear you if you leave, not hear you, but I can see messages if you leave a message, which is nice. So if you're inside, I'd love for you to leave a little comment now. Just let me know how you're doing. And, it feels good that I'm not like talking to myself, because that sometimes feels a little weird too. Yeah. Okay, let's shake out the body. Shake. We're going to rotate those hips now. So I want you to rotate around. Yeah, there we go. And then rotate it in the other direction. Good. We're going to create an L with the body. So as we did earlier, my feet in line with my hips, I'm going to extend. So shoulders in line with the hips. I'm going to reach, my hands are on my thighs, and I'm going to be pushing to those thighs, reaching those hips back, back, back. My weight is in my toes. I don't think you can see my feet. I'm going to scooch you just a little bit. Lift up, up, up. There we go. And we're going to just rotate the head side to side. We're feeling a nice stretch in those hamstrings again. Good. And then shake the body. So let's do a little bit of a facial yoga right now. So big smile here. We're going to bring in some gratitude and love. So appreciation for you today. Yay. Give yourself a big hug. Give yourself a big kiss. It's important to shower yourself with self-love every day, appreciating who you are. And think about it, if you're on the airplane and the oxygen mask comes, do they tell you to put the mask on your child first? Do they? No, they say put it on you first. Why do you need to put the oxygen mask on you first and then somebody else? Yes, because if you're passed out, you can't help anybody else. Same with life. We need to take care of ourselves first, not being selfish. It's being smart. And the more you can help yourself, you'll be able to help others. And it's okay to ask, just thou cup runneth over. Anybody relate to that? Yeah. We just work, we give, and then we're so tired. And the problem is, if we keep giving to everybody else, and which is lovely, it's important to give. Life is what you give, not just what you get. If you only give and you don't receive, it's depleting. And if you deplete yourself, you're not able to help other folks. So again, remember yourself to uplift your health, your body. Stretching, I think, is just paramount to life. It feels so good. And I know folks who do stretch, but they tell me 2 or 3 minutes a day. And I'm like, you're not going to get as much benefit. So if you can try to work up to 10, 20 minutes a day at least, if you're really stiff, at least twice a day. And if you can put in more in your body, do it, because you are definitely worth it. I kind of stretch throughout the day. That works for me. So figure out what works for your body. And again, it doesn't have to be extra time. You can be stretching literally while you're typing away, just kind of stretch out those hips. Honestly, safely. I sometimes, while I'm at a red light, I'll just gently turn my body, twist it. If I'm at my desk, I kind of stretching out my legs. I just lengthen one leg and then the other. But there's many ways to stretch, even when you're just standing around. If you're waiting in line somewhere, if you're doing work, you can still stretch out your body. Sometimes I'm doing this, even if on the phone, and just gently looking up. And think about it. How often do you look up? How often do you give gratitude in your life? Do you appreciate you? So really, really important. So here's my little boa. You can use whatever you have today. It might be just a little tie, or if you have a little band or something. I'm going to just use this to ring around. So we're going to open up the shoulders. And remember, with our chest, sometimes with allergies, we hunch forward. What happens if we do that? What happens to our lungs, our diaphragm, our area for breathing? Yeah, so we can be cut off. And if you're just congested and you're leaning forward, all that drainage is going to go forward, and it can, compound that headache. So it's actually good to be a little more upright. Open up that airway so you can get more air to breathe. Do that Nadi Sudhi. We're going to get back to in just a moment. Let's do our shoulder stuff first. So we're going to extend out, reach forward, and back. Yeah, I got to get higher for my head. All right. I am going to remove these little ears, and I love them. They're so cute, but they're getting in the way for a moment. Okay, so we're going to just go forward and then back. Good. One more time. And back. Good. And we're going to just bend those elbows, reach all the way over. You're feeling nice stretching the sideways. Try not to collapse where you're bending towards. So lengthen up first and reach, and then gently reach over to the other side. So lengthen between the ribs. Open up those muscles, create some space. Open up the shoulders. This is countering if you're sitting a lot at a computer, if you're hunched over. Remember, open up those airways. Allow those sinuses to breathe, to get some air. Yeah, aerate them. Hot steam helps. In your house, especially, we know there can be a lot of toxins or pollutants, just off-gassing from various things. Plants help with that. Again, if you're allergic to certain plants, don't have those, but I like the pothos or the peace lily, are nice plants to clean out the air. We also have, when I'm sleeping, I use a humidifier that helps clear up my sinuses, because everything is so dry, it dries us out even more. And then having a HEPA filter to clean out that air, and an ionizer. We use both. So let's massage out those cheeks again. So again, if you're just tuning in, we're doing yoga for allergies. This is Dr. Gold with Dr. Gold's Optimal Living Institute. We know it's allergy season, and it's my whole car is covered in pollen. It's like, can you relate? Do you have a car full of yellow? So it is the season, but remember, you don't have to suffer. Just because it's the season, it's like, I can enjoy. So if you really are very congested, you're doing conventional treatments, but are interested in some more natural, this can complement those treatments. And remember, if you're on steroids, of course, if you need them, you can't breathe without them. But sometimes I have patients weaning off. I use Breathe or On Guard quite a bit. Breathe it's an essential oil from doTERRA, but it has eucalyptus menthol, and On Guard has citrus or wild orange, along with a lot of other essential oils, cloves, cinnamon. But these help to boost the immune system, help you breathe better. I also was mentioning D-Hist, a natural antihistamine, and Quercetin, Quercetin. I also use for my immune system, vitamin D. It's shown to actually help with allergies. So we're going to do Nadi Sudi again. Thumb, fourth finger. We're going to close off that right nostril. Exhale through the left nostril. We're going to then inhale through the left nostril, close it off with the fourth finger. Exhale through the right nostril. I don't know if you can see me better from the right. Exhaling through the right. Inhaling through the right nostril, close it off with the thumb. Exhaling through the left nostril. And then inhaling through the left nostril and closing it off. And then just keep releasing and alternating. Good. Exhale. Inhale. Exhale. And inhale. Okay, let's do that one more time. Exhale. So I had Sally who came to visit me as a patient, really bad allergies. She's like, Dr. Gold, I don't know what to do. I'm a young mom. I have to be active with my kids, but I'm outside, I'm sneezing, coughing, just don't feel good and not sleeping well at night because I'm so congested. So what can I do? And I don't want to just be taking all these drugs that sometimes just make me drowsy. She was doing Benadryl and everything. Now, obviously, they have non-drowsy antihistamines or decongestants, but she said when I take the Sudafeds, they just make me too wired, and I just don't like that feeling. So again, we're talking about natural steam for her, sleeping a little more upright, and then getting allergy tested. Wouldn't it be nice to actually know what you're allergic to? For Sally, she's actually allergic to some foods. She was eating them pretty regularly. Go figure. So think about, again, if you're having allergies, why they may be going on. I have some folks, one patient I saw yesterday is on an elimination diet. So what they did is they eliminated all their supplements. And again, I'm saying to do this with a doctor's guidance. Don't just stop everything, or a nurse practitioner or a healthcare provider who you're seeing. But they got off everything and then slowly saw how they felt. Because honestly, if you stop everything, you feel great, which I have had some patients say that I stopped my medicines. Again, I'm not advocating for that, but they've started to feel better. You got to just start seeing, if you start adding it back, what to do. So the most important part is recognizing cause and then treating that. So with this last patient I was telling you about, she's realized with the supplements, when she eliminated them, she didn't actually feel very good. So she started putting back those supplements. Certain foods were not agreeing with her, dairy. So she kept that off. That sometimes can make you very congested. So paying attention where you're getting your dairy from does matter. And if you can get it locally is wonderful. I know I've mentioned many times Pam Lum's Farm, the Dancing Goats. That's where I get my milk and cheese. But it's again, from the source. I can visit the farm, see how they treat the animals, which is important to me. And I know a lot of patients who are feeling better depending on where they get their foods from. Because understanding if you're filling the animals with different products or feed or anything that's not their natural feed, it can affect their, and also if they're crowded. Okay, so we're going to rotate those hands again. Good. Let's massage the sinuses, just pressing. Good. Massage over here, just those cheeks, those jaws a little locked. And let's press on the forehead right now. So we're going to just soften the face, breathe here. I'm going to look up just a little bit, see if things not too far back, just a little bit. So you're opening up that neck area, breathing. Again, if this makes you cough a little bit, make sure you're hydrating, getting some water, really important. And check how much water, if you can do today, just check how much water am I drinking today. Hey, Zyrtec making sleepy. Will these other allergy alternatives make me? Very good question. So the Claritin and Zyrtec absolutely can make you tired. The D-Hist usually doesn't make you tired, which is great. And I'm very sensitive to medicines. I take, especially during this time of the year, I take the D-Hist by Orthomolecular. So it's a capital D hyphen capital H-I-S-T. And I also use Quercetin, Quercetin. And no, it doesn't make me very drowsy. Thank you for asking that question. It's a very good question. Thanks, Katie. And I usually say, no, it shouldn't, because you never know how somebody is exactly going to respond to medicines. I've had folks that literally take or drink coffee and they tell me it puts them to sleep. Well, most people, caffeine wakes them up. So you could get paradoxical effects, but for the most part, it shouldn't make you drowsy. So the question was, does Claritin and Zyrtec, it makes me very sleepy? Well, these other allergy alternatives make me sleepy. They usually don't. So, which is nice because, you know, sometimes we got to go, right? We're in the morning, we're getting ready to getting our kids ready for school or homeschool, or we're going to get to work, or we have our day ahead of us and we want to be moving. We don't want to be going back to sleep. So this is really key to help you stay awake. Now, if for whatever reason you're having to be on those medicines, you can't get the other medicines yet, and they make you drowsy, of course, use them in the evening. But if you need something now during the day, you want to have that effective dosing. And I have for some patients that they use this off-label, is they'll take the Claritin. For some, it does make them as drowsy, so they'll use that maybe one part of the day, and then they'll use the DHIS or the DHIS from orthomolecular another part of the day. So sometimes they'll use both, and that works. But I honestly have had people switch over, and they were fine too. So we can find a happy blend, is what I'm trying to say, especially with the massages that I was just saying and the breathing technique that can help. So this is another technique. Again, listen to your body when you do this. This is called fire breath. It has many different names depending on where you, which discipline of yoga or different places where you have looked for it. Because in almost every culture, they have different types of breathing techniques that's good for you. So as I mentioned before, they also call it holotropic breathing, but breathing from that diaphragm, moving and expanding that belly, really good. And I just finished a book called Breath by James Nestor, really excellent book. Honestly, I was reading it. I was listening to it by Audibles, and it was great because first of all, it's a long book, so on Audibles it was, but it was really nice because I can do it while I'm driving, while I'm commuting to work, or different things I have to do throughout the day. So it wasn't taking up extra time. So I like a lot of times to do audibles. But one of the key messages in that book is trying not to be a mouth breather. Just think of in the mouth, there's our mouth is our window to our body, right? So the idea is if you're primarily a mouth breather, organisms, a lot of things can get right inside. And I understand why you breathe through your mouth if your nose is congested. But the idea is to try to open up those nostrils with the breathing techniques. I mentioned some natural decongestants, even the essential oils. I'll sometimes take a drop. If you put it through a diffuser, you just breathe that in. Eucalyptus menthol, it's called Breathe. That's my go-to for a lot of patients. And if you ever do put on your skin, you want to be cautious because these are essential oils. Typically they're inhaled, but I do put a drop on my hand just with coconut oil, rub it together and just breathe it in. And close your eyes because it can burn. But that helps to open up so I can breathe better and feel better. So really important so one message is he said to close your mouth and start working to breathe through the nostrils because in your nose you have filters. So you want to stand up nice and tall here. Let's close our mouth for a moment. Inhale. See if you can allow that belly to rise. So if you can see my stomach for a moment. Inhaling, expanding that belly. Exhaling, contracting. So notice my shoulders not moving, my belly moves. The reason that's important, we're using that diaphragm more. It'll expand those lungs even more and helps get rid of toxins that we know we want to get rid of the CO2. And that was his other message. Our CO2 can drive respiration. So the more we can breathe deeply, but slowly. So not a shallow breath, not breathing through the shoulders, taking your time to breathe and smile can make a huge difference. So let's do a nice deep breath. Inhale. And the easiest way I know too is laughter. Ha ha ha. So let's do a little laughter here. Feel your belly moving as you laugh. Now, if you're faking it right now, I get it. Sometimes you're like, oh, I don't feel like laughing. It's early morning. Do your best. Try to get your eyes involved as well. Get your belly. It's a great workout. Some studies have shown that you work deeper abdominal muscles when you are laughing heartily. 20 minutes is the ideal. You can always do more, at least 20 minutes. If you can't get to 20, do for 1 minute. It's okay. Do something. So in-depth laughter, ha ha ha, can clear you out. It actually helps a lot for me too. So it helps open up blood vessels by 22%, so more oxygen to the brain. You release endorphins, feel good hormones, and you also drop pain too. Because of the opiates, you're also releasing natural pain relievers. So these natural opiates that get released dispel or dissipate pain, so you feel it helps rechange or help refocus, so you're not focusing on the pain, feeling better, feeling, and I don't like that P word, so I'm going to change it to a hiccup. Little discomfort or little bollocks. I tell you, it's bollocks. Okay, let's do another nice deep breath in. Reach up. Good. Reach all the way over. Oh, reach back. Good. Open up the heart, open up the sinuses. Let everything go. So one thing also, when you're doing a stretch class, I wouldn't recommend bending completely forward. All that stuff, if you're draining stuff and you lean all the way forward, you already know. Now it can come out, so that's good. But if you're dizzy or lightheaded, just come halfway forward. If you're able to, you cleaned out your sinus and now you're able to bend forward, great. You just did the breathing techniques, but you don't want to force it. Oh, and let me go back to fire breath. So the fire breath is quick exhales. Again, this is just to get that engine revving. It does warm up the body a little bit, but it also helps if you're congested to get some stuff out. So again, listen to your body. Don't ever overdo. If you need a break from it, take a break. But we're going to do it for a few seconds right now just to start off so you can see it. It's just short exhales, okay? So you're going to follow me. I'll demonstrate first. So we're going to, and it's everything is from the nose, as we mentioned for James Nestor's book for breath, which is a great book on breathing better. It also talks about like if people suffering from allergies, asthma, keep the mouth closed. And one thing he also, this is a side note, is chewing. He mentioned that our soft food diet right now has kind of weakened our jaw muscles. And because the mouth is kind of reconfigured, everything's smaller, we're not able to breathe as well as we used to. And also think of all the chemicals that we are exposed to nowadays versus way back where in our ancestors' period. So he said get more healthy, chewy foods like raw foods and other stuff that you have to chew. So I actually got some collard greens from one of my patients yesterday. She's so sweet. She has a beautiful garden. She had extra stuff. She's like, is it okay? She goes, I would love to give you this. And I'm like, where are you? I'm coming. So I got my husband actually sweet enough to go there and pick up all these huge amount of collard greens. But that's chewy foods. So before I cook it, and I'll probably cook it later, but you don't have to eat all soft foods unless, something with your diet only allows that to happen. But if you can chew, so much better for that jaw. It's an exercise for those muscles and it opens up. But what they were finding is a lot more allergies more recently over the last century versus way back when, before all the chemicals, when we had more raw food type diets, when we were chewing our foods more. Now a lot of foods are soft. And it's okay to ask, how many foods do you eat that you actually have to chew? Outside of gum and taffy, I'm talking about healthy foods. How many foods, nuts, seeds? I know I've chewed into a beet. That was a little too hard for me. But definitely like some tempeh soft too. But the collard greens I was chewing yesterday, so I'm going to eat some of those. But just at least work the jaw a little bit more. And if you don't have the food, you can just pretend and chew. But that's also supposed to be really good. And again, breathing through the nose more, slow and deep. So I'm going to do that right now. So again, follow me. I'm going to start, and then I just want you to follow. Just join in, okay? Oh, and one other disclaimer. If your nose starts to run, and I apologize if mine does, have some tissues nearby. You might need some tissues for these types of breathing exercises. So it's a short exhale, again, through those nostrils. Take a moment. Now, for the people who have practiced this a long time, some people are doing this for like a minute, a few minutes. If you're new to this, it can make you a little lightheaded, dizzy. I recommended doing it in a chair or sitting down when you first do it if you're not familiar. Also hydrating, not while you're doing it, you don't want to choke, but drinking water beforehand or after if everything's starting to clear or come up. Take a pause, blow your nose if you need to, and then hydrate, drink water. We know I saw a patient 2 days ago, and he's a Parkinson's patient, he's just really tired, stiff. He says his muscles aches, he's not sleeping as well, low energy. I said, how much water do you drink? And his wife is a nurse, and she goes, his urine is dark. Think about it. If your urine is dark, you're not hydrating. What's happening to the rest of your body? What's happening to your muscles? Yeah, what's happening to your energy, blood flow? Yeah, so everything's diminished. It's amazing. And headaches, you can actually get more headaches. And if you have allergies, everything can get thicker and stay more stuck inside those sinuses. So just lubricate. Think of water as kind of the river through our bodies, that it helps expel things and get rid of things. Even our lymph fluids, we just need to let things flow out. And our muscles, since they're mostly water, if the water's not there, this is going to tighten up. So you're not going to feel so good. So cramps, headaches, energy, all down usually. And a simple remedy. So hydrate. If you are sweating a lot, you're outside, electrolytes, because that water's not going to get into your cells well enough if you're just drinking only water. And then pay attention to the amount. We don't want you to overhydrate. You can get something called hyponatremia, low sodium. So it's a healthy balance. General rule of thumb, if you're not suffering with like congestive heart failure or kidney problem, is half your body weight in ounces. You probably have heard that, or you heard 8 glasses. Obviously, you're not going to give 8 glasses to a baby. It depends on your body size. That's why I mentioned that half your body weight in ounces, and the weight is in pounds. So did I see that? Yeah, half your body weight. So I weigh about like 130, so just 65 ounces, so half a gallon. But each person's different. Just check approximately. And if you are not there, you drink 1 cup and you're 300 pounds, don't start with half your body weight. You're going to get waterlogged, and it's going to be uncomfortable. You're going to pee all the time and just not feel good. And you're going to stop doing it. So work up. If you start with one small bottle, start the next day, go to 2, go to 2.5, go to 3. So gradually up the water intake. And most important part is pay attention to how much you're drinking. So I have many folks say, oh, I drink enough. So I said, okay, just one day, pay attention to how many bottles of water or how much water. And if you're like, oh, it's too hard, I take sips here, just get a big container, maybe a gallon if you're, need to drink a gallon a day, and just see how much you get through that gallon for that one day. And you can guesstimate approximately, but you'll get a better idea versus just sip, sip, sip here and there. It can be harder. Okay, just rotate those wrists. Okay, we are going to be wrapping up, if you can believe it. Time has passed so quickly. Okay, so we're going to rotate those shoulders. Big smile here. Open up. So we're going to close with a Shavasana, which is final relaxation. You can do this any way you like. The purpose of Shavasana or final relaxation is to close down your practice, to complete the practice. It's a way to empty the mind in a healthy way. We don't not have any thoughts, because every patient say, I can't shut off my mind. Until you're dead, you can't shut it off. But what you can do is quiet the mind. You can turn down the volume. You can, all the noises that I got to get this done or do that, or I didn't get this done yesterday, or I'm so stressed, worried about this. This is that time giving yourself permission to let go. And one also suggestion I've had with many of my patients is set a worry time. It sounds crazy, but for many of my patients, it works. From like 12:57 to 1:03, like a weird time. Don't put it at like 1 o'clock or something, or not for long periods, because who wants to worry for long periods of time? So for just a few minutes, say that's my worry time. The rest of my day, I'm going to do what I need to do. If I need to take pauses or breaths, breathing breaks, I'm going to do that. And you can now some different breathing techniques. But taking time for you, and then just if you need that worry time, that's the time you can go drive yourself crazy or just worry about stuff. But then the rest of the day, let it go. Enjoy your life. I mean, honestly, do you want to live like this, worried about stuff? And I get it. It is sometimes a habit, or there is mental illness. Of course, that's real. But remember that you can help or complement with these techniques, the breathing techniques, you can actually learn ways to help focus your mind, to reframe, to look at things differently. I actually had a patient yesterday. She's a supervisor and she is a behavioral analyst. I'm learning all the lingo. And she said she works with RBTs. I was like, okay. but basically she is just stressed out. She said, I was fine as a therapist. They, promoted me. I get more money, but I'm just like this. And she's in her 20s and she literally was crying in my office. Of course, I'm like, so sorry for, everything you're going through, but just know there's hope. You can get better. You're not identified by an illness. Because she's like, I'm anxious. I'm depressed. I was like, let's take a deep breath. And we literally just reframed on things she loves to do. And I said, you have some options here. You can stay with where you are and reframe it. But if you really don't love what you're doing, which she doesn't, it's okay to take a move or figure out what you want to start doing, even if it's the pay cut, but you're so happy. It's okay to weigh that balance. Like, honestly, if you're in a job, you're getting so much money, but all that money's going to medical bills. It's okay to look at that as well. Or again, reframing the position. Or do you want to do something else too? This is a time a lot of people are going back to school. So there's many, many opportunities. If you see them, you can allow that into your heart, figure out ways to grow and expand. But we're also going to check our hormones because there could be a functional medicine cause for what's going on. So making sure we're not missing anything. She also wants to have a child. So I said, what happens if you're not getting pregnant? What's the ideal to get pregnant? What kind of body type? Yeah, a healthy body for the most part. We know people that are healthy, that their immune system is strong, generally speaking, they can get pregnant and it's on both parties. And she actually said her husband had some issues with his sperm count. So of course that's 40% can affect the fertility causes. So she's going to get that worked out as well. But, there's many things that she can start to do to help ease the stress. And my sister was having some of this stuff going on. She used a new mantra called calm mommy, calm baby, because, miscarriage is very common. And, what is the statistics? Like a large percentage of women have this. They don't speak about it because they either are embarrassed, they don't feel comfortable doing it. And, but it's one of those things that definitely happens in life. I know Michelle Obama spoke about it in her book, Becoming, great book. And it's real, it happens. So knowing that whatever's going on in your life, you can overcome, you can get through it. And especially if you're trying to conceive and it's not happening, taking that step back, getting healthier, figuring out your hormones can make a huge difference. Okay, so let's interlace those fingers. And you can come to a seated position or not. I'm going to start to come down. So we're going to go to the floor. Oi. There we go. Okay. So when we're breathing here, I want you to take that moment. See if you can grow at the back of the neck as well as the front of the neck. Lengthen. Big smile here. And we're going to use that alternate nostril to close. As we're doing this, we're going to use some words. So I'm exhaling, releasing any tension, letting go of any worry. Inhale, calming the mind, calming the body. But we're going to actually just go exhale, release, inhale, uplift. Okay, so let's start exhaling through that left nostril. My thumb is covering my right nostril. Exhaling, release. Inhale, uplift. So I close off my left nostril as I inhale. Exhale first through the left nostril. Inhale through the left nostril, uplift. Close it off. Exhale, release through the right nostril, uplift through that right nostril, closing it off with the thumb. So exhaling, inhaling, left side, exhaling through the right side, inhaling through the right side. So just going back and forth. I'll show you from the side view. Exhale, inhale. Close it off, exhale. Good. We're just going to do some deep breathing through our nose. Exhale, release, let go. Inhale, smile, uplift. Good. One more time. Good. We're going to Rub our hands together. Just cup your eyes. Breathe. Good. Big smile here. Good. Another deep breath in. See if you can just mainly breathe through your nostrils. Again, if your nose is congested, you can open your mouth a little bit, but let's start working on breathing through the nose more. Slowly, fully moving that belly as you breathe. Now, if I said a lot of things, just pick one. Pick one thing you need to focus on the most and what will give you the most benefit. Good. Nice deep breath in again. Good. And let's press on those sinuses. Oh, now the other option, if you're like, this is all good and dandy, but is it possible to get a massage, like a sinus massage or a facial massage? Absolutely. And they can actually press on those sinuses. It may be a little tender or sore initially, but as they kind of loosen up, and if they're allowing a diffuser to help you breathe in, some eucalyptus menthol if you're not allergic to that. If you are peppermint, there's a lot of different essential oils you can use to breathe in. If you're not good with scents, just hot steam. That works really well just to open you up. I know people who take hot showers. Just if you're lightheaded, dizzy, be mindful, be careful in that shower. We don't want you passing out or falling. Make sure you hydrate beforehand. Good. And then just press on the forehead and right above the nose area. Oh, that feels so good. Okay, so I'm going to just close with a nice little peaceful offering that you can improve, you can get better, you can live your optimal life. We keep focusing if we're going through stuff, and honestly, everybody's going through something, right? With COVID, we kind of share this pandemic throughout the world, and it's hard to go through something, but when you know you're not going through it alone, there's millions of people suffering with allergies, but remember, we can even change the word suffering to a hiccup. It's a little disconcerting. It's driving me a little whoo, but I'm going to be okay. You can smile about it and just say, what can I start doing about this to the best of my ability? And can I make improvements? Can I drink some more water? Can I use some more hot steam? If something works for me, can I do it a little bit more? And can I see myself getting better? Maybe with a little vision board of myself healthy, well, feeling good. And if I haven't had allergy testing in a while, can I recheck that? Just make sure nothing new has developed. And maybe try some of the new natural supplements I mentioned, the dehisced or quercetin. There's always something, right? And there's new things out on the market all the time. Vitamin C, zinc, vitamin D can help boost that immune system so you start feeling better. And feel free to chime in anything that you use, some natural remedies that you want to share. I'd love to hear your thoughts on this. But I know that there are answers, and we are creating a new private Facebook group. It's called Happy Living with Dr.Gold. So if you want to check that out on my Facebook page, I'd love for you to join. And it's going to be tied into folks who want to get better, want to uplift one another as well, but will be also a forum for sharing ideas too. So let's take another nice deep breath in. This time my backs of my hands are together, fingers pointing up, palms facing out, and we're bringing in joy, happiness, peace. You have a beautiful day. Namaste means the light in me honors the light in you, and live optimally. Mwah. Dr. Gold, wishing you a happy day and suffering less with your allergies or hiccuping less. Bringing joy into those hearts with less discomfort and being at ease, and you can. So remember, dis-ease, not so fun, but releasing that. So creating ease into that body with natural treatments, with using the best medicine for you. Take care now.